Welcome to the Deep Dive. Today we're taking a deep dive into our quality improvement project, trauma-informed consent-based communication during pelvic exams. Our focus is on transforming the pelvic exam from a routine procedure into a patient-centered collaborative experience, one really grounded in empathy, safety, and trust. Here's where we're headed. First, the patient voice, why this matters. Then the current state of pelvic exams, before, during, and after the visit. Next, our PICO question that defines the problem. After that, the intervention, how consent-based trauma-informed communication can change care. And finally, measurement, how we'll know it works. Let's start with the patient voice. Many describe pelvic exams as painful, frightening, or deeply exposing, an experience that can leave them feeling powerless in a place meant for healing. Patients have said, the experience of being exposed, I felt that my body was separate from me. I couldn't relax. I was unprepared. The pain exceeded my expectations. I felt exposed, like my private self was on display. These reflections remind us that pelvic exams are not just clinical. They are deeply personal, vulnerable moments that demand empathy and consent. We found some pretty interesting studies. 11 to 60% of women report pain or significant discomfort during routine pelvic exams. On top of that, 10 to 80% of women report anticipatory fear, embarrassment, or anxiety, just even before or after the pelvic exams. Pain and emotional distress don't just end after the appointment, they ripple outward. Many women delay or refuse future care because of prior painful or humiliating experiences. Follow-up rates for abnormal findings can range from 4 to 75%, often due to fear or shame. Pelvic procedures can reactivate trauma, especially for survivors of sexual violence causing flashbacks or dissociation. This cycle, pain to fear to avoidance, delays diagnosis, worsens outcomes, and amplifies inequities in reproductive health. To change this, we first examined what the pelvic exam looks like now, before, during, and after the visit. What we found were missed opportunities for communication and partnership at every step. Before the exam even begins, communication gaps emerge. Patients often arrive uncertain about what will happen, why each step is needed, or how they can voice concerns. Standard pre-visit interactions focus on logistics, not emotional readiness or consent preferences. When patients aren't invited into the process early, anxiety rises and trust weakens before any care is delivered. During the exam, the standard of care emphasizes accuracy and efficiency, but often at the expense of patient comfort and agency. Many patients describe not feeling in control. The exam moves forward with minimal ongoing consent checks or opportunity to pause. Without intentional trauma-informed communication, what should be a routine procedure can feel invasive or be re-traumatizing. After the exam, most encounters shift immediately to documentation next steps. This is a critical moment to reestablish safety and dignity. Without space for debriefing or reflection, patients may leave feeling dismissed or unheard. These missed opportunities compound over time, contributing to avoidance of future exams and erosion of trust and care. From these insights, we developed our PICO question. Among women undergoing pelvic exams in outpatient clinics, does implementing trauma-informed, consent-based communication, compared with the current standard of care, reduce patient-reported pain and distress, improve trust, and increase follow-up? Our intervention reframes the pelvic exam as a collaborative process grounded in trauma-informed principles, anticipating vulnerability, validating consent at every step, and emphasizing clear, compassionate communication. Our aim is to put the patient in control, enhance patient trust, and increase satisfaction while reducing anxiety, fear, and re-traumatization. Our tools are both simple and powerful. Supplies: heated speculums, gel, and exam tables, multiple speculum sizes. For environment, there should be dimmable lighting, covered space for belongings, and an option for a support person. Language: swapping words like loop for gel, abnormal for results needing attention. Lastly, process: combining steps when possible. For example, using a single sample for PAP and STI test. Healthcare literacy can be a barrier to understanding why pelvic exams are needed. Clear, accessible explanations improve comprehension and reduce fear. Providers should communicate updated guidelines like screening ages and IUD longevity to build patient confidence. When providing patient care, one of the biggest barriers we face is the lack of clear consent-based communication before the visit even begins. When patients aren't informed ahead of time about important details, such as pre-visit steps like taking pain medication before an IUD insertion or how long the appointment will take, it can lead to uncertainty, anxiety, and reduced trust. Consent-based communication means ensuring patient fully understands what to expect, what procedures will be performed, and any potential discomfort involved. Providing this information before the appointment allows patients the time to process, ask questions, and decide how comfortable they feel moving forward. Ultimately, patients should feel informed, respected, and in control of their care. By clearly explaining confidentiality, autonomy, and each step of the visit, we empower patients to make decisions that align with their values and foster a stronger, more trusting provider-patient relationship. From the moment a patient walks in, the space should feel calm and supportive. This might include offering stress toys, playing relaxing music, and ensuring staff approach every interaction with empathy and respect. For many patients, pelvic exams can bring up feelings of vulnerability or past trauma. When the office environment feels calm and non-judgmental, it helps patients feel seen and supported rather than anxious or rushed. Equally important is allowing enough time for discussion and informed consent, never double booking or cutting corners. When patients feel that their comfort and autonomy are prioritized, it builds trust and supports true consent-based communication. This preparation and attention to detail helps patients arrive feeling safe, informed, and empowered in their care experience. The point in which the most pain and discomfort occurs during a pelvic exam or a procedure visit is in the exam room. Traditionally, the provider is in control, but realistically, the patient should lead what goes on in this room and how the exam takes place. It is up to the provider to ensure the proper dynamic is maintained throughout the visit. At the start of the visit, communication begins even before the exam does. A provider might say something like this: "Your feet will go in these stirrups that I'll pull out from the exam table once we begin. Before that, please scoot all the way down to the edge so I can see clearly and make sure you're comfortable." The goal is to reduce uncertainty, explaining each step before it happens. During the procedure, clear and steady updates continue. You'll first feel my fingers in some warm gel. Then you'll feel the speculum and a bit more gel. You may feel some pressure as it opens. The provider should check in. "How does this feel? Are you okay to continue?" And reminds the patient, "If you'd like me to pause during or throughout the procedure, please tell me." This kind of communication keeps consent active, not assumed. After the procedure, the tone shifts to reassurance and follow-up. "How are you feeling right now? Mild cramping or spotting is normal. If you experience heavier bleeding or discomfort, call our office or make sure to seek emergent care." A 2017 study found that 56% of women don't understand why they received a pelvic exam afterward. That gap can be closed by taking just a few minutes to explain the purpose and next steps. After the pelvic exam, it's important to make sure to keep the communication open. First, a follow-up visit should be scheduled before leaving the visit to have a face-to-face interaction that allows the patient to talk to a professional directly. During the follow-up visit, the provider would be able to check the placement of the IUD and allow the patient to ask any lingering questions about care. Some studies show that during the follow-up visit, having an RN to answer most questions allowed the RN to give personalized care, allowing the provider to give more energy to patients when they're coming in. A phone call can also be an option that can address any questions that could prevent complications, go over results to prevent misunderstanding, and ask what measure could have been added to better enhance their experience. Lastly, sending anonymous surveys or chats open to providers and nurses may help to cover information that a patient forgets to say in a visit or phone call. Our intervention focuses on creating measurable change in both clinical outcomes and patient experience. We'll track clinical outcomes like correct placement of IUDs and delivery of RN-based individualized care to ensure accuracy and consistency. But most importantly, we'll listen to our patients. Anonymous post-visit surveys will ask two key questions. Did you experience pain during your procedure? And did your provider use trauma-informed consent-based communication? We'll compare this data to baseline scores looking for lower pain and distress ratings, higher trust and satisfaction, and stronger follow-up continuity. By analyzing this feedback quarterly, we can identify trends, refine provider training, and continuously improve how care is delivered. When care begins with empathy and communication, a pelvic exam becomes more than a procedure. It becomes a partnership. Our goal isn't just to reduce pain, it's to restore agency. Through trauma-informed consent-based communication, we can rebuild trust, enhance safety, and create lasting change in women's health. That's how we measure impact, through comfort, connection, and confidence in care.